right. My name is Miller Hancock. This is my head-to-toe assessment for NU 361. I have my patient here. Before we get started, I have asked him if this was okay to perform this procedure. He's given me consent. I have performed hand hygiene, provided privacy for us, and have introduced myself as Miller the nurse. This is the correct patient. This is Tony Hancock, my dad, that I'm performing this assessment on. Before we get started, this is head to toe. You consent to a head to toe assessment on me today.
Sure.
All right. So let's go over some medical history and patient's history. So he has a history of hypertension. His family history is cardiovascular events and cardiovascular health is poor in his family. So we're going to be sure and review a couple important education tips at the end of this video. So his social history, he does not use any tobacco products or alcohol. He takes his medications. He takes Benicar HCTZ for his blood pressure. He has no known allergies. On his mother's side, his maternal grandfather had a cardiovascular event that ended in death and a heart attack. His uncle on his maternal side also had a cardiovascular event resulting in a heart attack as well. Other than that, it's cancer on both sides of his family, and his father also has new onset of congestive heart failure. He's 74 years old. So that's his family history. Went through social, no allergies, medications, no significant surgeries or any events. He did cut his knee, right knee, in 2020 in a chainsaw accident. No complications there. He had surgery on his AC joint in his right shoulder in 2023. No complications there. Vaccinations. So he has had his pertussis, mumps, rubella, and tetanus shot back in 2020. Tetanus shot was in 2020. The other vaccinations were as a child. He is currently active. He works out 2 to 3 times, he reports, a week, mainly focused on cardiovascular health and strength training. And that's pretty much it. So we're going to start with the head to toe. So first off, we'll start with starting with the head. We'll go over the skin, the features, his skin's normal skin tone. We're going to look at his skull, front, back, everything's symmetrical. Yeah, we can don some gloves. I'm prepared with some gloves. So face is symmetrical, head looks good, skin is good. We'll assess the scalp. Scalp intact, no abnormalities, lice, none of that stuff. Now we're going to move down to his temporal arteries. We can feel these bilaterally at the same time. So they are bounding +2 pulses on each side. We're now going to move to the jaw. I'm going to assess his jaw strength. Can you flex your jaw for me? Yep. Intact there. Relax. Good. All right. Try to open your jaw. I'm going to apply some force. Open your jaw. All right. Perfect. No abnormalities there. Open your jaw for me. Great. All right. No popping or clicking there. Now we're going to move to, let's see. Let me grab my sheet. Arteries, jaw, resistance. Let's do facial expressions. So let's big smile for me. All right, poke out your cheeks. Raise your eyebrows for me. Perfect. Everything looks symmetrical. Now we're going to go to the Eyes. So first off, I've got a Snell visual acuity sheet here. Here's his visual acuity. We'll start with that. I'm going to place it right here. Typically, you would want to get around 30 feet from that. So we're going to test visual acuity first. So do me a favor. He wears reading glasses. These are his reading glasses. Let's cover up your left eye and read down as far as you can read for me.
EFPTOZLPEDPECFD PELOP2ZD.
Okay.
That's about it.
Cool. All right. So he's got 20/32 at this distance in his right eye. So cover the opposite eye that you did. All right. So we'll do the left. So read far as you can go on the left.
EFPTOZLPEDPECFCZP.
That's okay.
Yeah.
All right. So on that side, that was your left eye, right?
Mm-hmm.
Left eye, he would be 20/40. All right. Let's go both eyes.
EFPTOZLPEDPECFD EDFCZP FELOPZD DEFPOTECLEFODFCT.
Cool. All right. That was 20/20 in both eyes. Great. So now we're going to test the cranial nerves 3, 4, and 6. So we'll do the 6 visual fields, and then we'll do accommodation. So I got my pen light here. I want you to stare at this pen light and do not move your head, okay? Just your eyes, all right? Okay. We're going to do the 6 views. All right. Eyes are moving appropriate, no nystagmus or none of that stuff. Perfect. All right, now we'll do the accommodation. I'm going to come close and touch your nose, okay? You just stay focused on this light, okay? All right. Eyes came in, pupils kind of constricted at the last minute, so that's good. We're going to do the light test on his pupils. I would dim the lights in a clinical setting and do the eye test. So we'll look over this shoulder for me. And we'll bring light in your eye. Good constriction on that side. Look over the shoulder. Good constriction on that side. Perfect. Now I'm gonna palpate his eyes. Check the conjunctiva, the sclera, the pupils. Yeah. All right. I'm gonna look at the conjunctiva. Good. Slightly red, but nothing out of the normal. His sclera is nice and appropriate color. Eyes look good in that order. Okay. Moving on. We did the eye structure. Eyeballs, perfect. Test for accommodation, good. All right, let's move down to the ears. So I'm going to assess his ears first by looking at them. Ears look intact, symmetrical, nothing abnormal. He doesn't have any hearing aids or anything like that. So I'm going to cover up this side of your ear. I'm going to whisper a phrase and you repeat it back to me. So I'm going to cover up this side. What did I say?
Apples, oranges.
Perfect, that's correct.
Good afternoon.
Perfect, and that's correct. So, did that. All right, now let's move down to the nose. So just assessing the nose, looking at it, no abnormalities. He has broken his nose in the past. Has broken his nose in the past, but other than that, no symptoms. Are you breathing? Okay, breathe through both of them at the same time. Close the left one for me. Breathe in. Perfect. Close the right one. All right. left one's a
A
little,
little stopped up.
maybe a little stopped up, deviated on that left side. All right, now I'm gonna kind of palpate your sinuses here. Sinus pressure. He's got some pressure going on right now. Any pain there? All right. Now we're gonna go look in the mouth and check the mucosal structures, tonsils, stuff like that, cavities. All right. Let's take a look. Stick your tongue out. Good deal. All right. Stick your tongue left to right. Go left to right. Perfect. All right. No something's there. Lift your tongue up. No obvious lumps or anything. I'm gonna get the tongue depressor. Check you out here. Stick your tongue out for me. Alright. Slight redness in the back of the tonsils. Nothing crazy. Alright, gag reflex. Yep, gag reflex is intact. Good. Alright. Let's look at the mobility.
I went to the doctor yesterday with the sore throat.
Alright. Got the tongue, did the tonsils, pen light. Alright, now we're going to move to the neck. So we're going to do the lymph nodes. I'm going to check, they got multiple lymph nodes on here, so I might have to refer to my paper for the lymph node pronunciation. So, first of all, let's move your head back and forth, see if you feel any pain in you there. Go front to back, chin to the chest. Alright, ear to shoulder. Alright, no pain there.
A lot of crunching.
Yeah, okay. Alright, let's look at the lymph nodes. So we'll start with the pre-auricular lymph node, and then we'll go to the post-auricular. So the pre-auricular are going to be right here in front of the ears. Any pain in here? Post-auricular. Occipital. Any pain there? Submandibular, under here. Submental, any pain in here? Okay. Posterior cervical, any pain in here? No. Supraclavicular, any pain in here? And then we got deep cervical, and then supraclavicular, any pain in there? Perfect.
Feels pretty good.
Alright. We did the neck, chin to chest, all that stuff. Now we're going to palpate the thyroid and the trachea. Let's see. Thyroid. Alright, lean up for me. Alright, no lumps or anything like that. We'll do the trachea. Everything seems intact there. Alright, now I'm going to listen for bruits, which is going to be in the carotid arteries. First, we'll palpate each one.
Watch it here.
Okay. Now we'll palpate each one. Alright, perfect, +2 bounding. Perfect, +2 bounding. Now we'll go to we'll switch to the bell and listen for bruits in the carotid. Alright, take a deep breath and hold it for me. Or take a deep breath, let it out, and hold it when you let out. Alright, hold it. Okay, no bruise. Relax. Alright, take a deep breath. In, out. Hold it. Alright, no bruise there. Alright. So now we'll go to the arms. No, we'll go to the chest. So first, let's get you in the bed. Well, no, this one's not in the bed. Alright, first we're going to inspect the chest. take a look at the chest. No barrel chest that you would see in COPD patients. Chest looks normal. Let's switch over to posterior side. So I'm going to take my hands and I'm going to listen for any vibrations when you say the words 99. So say 99 for me.
99.
Perfect. Good vibrations. Say it again.
99.
Perfect. One more time.
99.
All right. Now I got to see the word to pronounce this word. I'm going to test the costovertebral angle for the kidney tenderness, okay, in your flanks. Scoot up for me. Perfect. Let's see. All right. So I'm going to feel the costovertebral area, and I'm going to give one good thud right here. You tell me if you feel any tenderness, okay? Any tenderness in that area? All right, I'm going to switch over to this left side of kidney. All right, let me know any tenderness. No tenderness? Good deal.
Maybe set one of those pictures on top of your thing, computer one. You know what I mean?
Let's see.
See the pictures.
I don't know what they're talking about.
You can set maybe this on. It won't go out maybe.
No, it's okay. I think it has to be touched. I'm gonna flip you over here. Turn over. I'm gonna show them where I did the percussion there. So right here, we did that side. No pain there. No pain there.
No.
Okay. Now I'm gonna listen to you. Stay turned around so they can listen to you. I'm gonna listen to all your lungs here in the back. Switch it over. All right, take a big breath in. Perfect. Breath in. Good. Breath in. Perfect. Good. One more. Perfect. Have a seat. I'm gonna go to your chest. Breathe in for me. Perfect. Alright. Reference here. Tactile friendliness, all lung feel, flank, breast sounds. Alright. Upper extremities. So now I'm gonna feel your ulnar and radius arteries. Hold your arms up for me. Radius +2 bounding. Okay. +2 bounding. Perfect. Just upon inspection, no abnormalities. Arms look good. So let's go. Raise your arms above your head, behind your back. Perfect. No abnormalities there. Yeah. Okay. All right. Now I'm gonna do some resistance on you. You push your arm up with a little resistance. Okay. Start at the bottom. All right. Go up. Perfect. Push me down. Abducts and adducts. Okay. Go up. Good. Push me down. Perfect. Now hold your arms out there. Supinate. All right. Pronate. Perfect. Let's look at the wrist mobility. Do wrist up and down. Pronate. Supinate. Make a fist for me. All right. Squeeze bilateral. Squeeze my hand. Perfect. All right. Make a fist. You did that. Spread out your fingers. Good. Perfect. All right. What are we missing? Capri fill, radials, arm bugs, head, adducts, flexion, extend the elbow, okay. Wrist, okay. All right. we're gonna let's see. I'm gonna take your elbow. I'm gonna do just relax. The crunchy feeling there. Alright. Let's see. Let's do I'm gonna draw a number in your I'm gonna draw a number in your hand. You tell me what that number is, okay?
8.
Perfect. Alright. Now I'm gonna let's see. Alright, now I want you to take your pointer finger, touch your nose to my finger. This is the cerebellum, we're testing the cerebellum. So put your nose to your finger to your nose and then touch my finger. Perfect. Boom. Do it again. Alright. One more time. Good. Alright, that's intact. Alright. So now let's do the cerebellum, do the gravisthesis, and then the stereodosis. So, alright. Let's do the tricep and bicep reflexes. So we'll start, got my hammer here. Start with the tricep reflex. So in this one, you just relax. I'm going to tap your deep tendon right here on your tricep, okay? With this test, his tricep should flex, and his arm right here will kind of flex, okay? So we'll try to get that deep tendon right there. Flip the side. So we have slight. All right. Let's do this side. Relax for me. Try to get this deep tendon. Okay. That one did a little bit better. Alright, let's do the bicep. Tune the deep tendon right here. Feel about right there. Okay, got a slight movement down here. Bicep tendon here. Okay, slight there. Okay. All right. Now we got a brachial. So let's test the brachial when it's down here. Deep tendon reflex here. Okay, that one's intact. Saw slight movement in the fingers. Okay, got a watch on right there. All right. Now we're going to go to the chest. So we'll go lying down over here. Let's switch the computer.
Lying down on my back.
Yeah. Let's see. Let's see if we can get in a good position. On your back. Lie down. All right. So we're assessing the anterior chest. So first off, I'll just want to assess. We'll lift the shirt up a little bit. Assess everything. So he looks good. Breathing pattern normal. Okay. So now we'll take a listen. Let's see. Inspecting. No umbilicus intact. No hernia there. Okay. So we'll inspect the valves of the heart. Let's go aortic valve. S1, S2. got good sounds in all those. So hope we can see that right there. All right. All right, and then we will do the auscultate. We did that. So we'll palpate kind of the sternum here. Tell me if you feel any pain or anything.
Feels weird.
No pain, nothing. Okay. No abnormalities there. So now we'll go move on to the abdomen. So we're going to inspect. We're going to auscultate, percuss, and palpate last to keep that gastric mobility down. So looking at him, no distension, nothing like that. Any abdominal pain right now? Perfect. So we'll auscultate all 4 quadrants, starting with the right lower, and go counterclockwise. Got bowel sounds present. Right lower, upper right. Bowel sounds present. Now we're going to percuss. So we'll just percuss each one. Okay. Liver's on this side, so it should be. Alright. No pain there. Now we'll palpate. We'll do a light palpation starting in the lower. Any pain there? Alright, no lumps or nothing felt here. Alright. Now we'll do a deep palpation. So we'll go a little deeper. You let me know if you got any pain in here. No pain in there. Good deal. Alright. Let's see. We did the percussion, palpation, all 4 quadrants, light palpation, deep. Alright, we did it in the right order. Alright, so lower extremities. First we're going to inspect the lower extremities. No abnormalities here. Alright, we'll check the pulses. So this will be the popliteal pulse back here, behind the knee. Perfect. +2 bounding. Dorsalis pedis on the top here. Light pulse there. And then this is the tibia, posterior tibia. Alright, got it there. Let's check this side. Tibial. Alright, this is the popliteal back here. Good, +2 bounding. Dorsalis pedis. Good, better. Alright, good on this side. Alright, no edema. No edema present. Feeling on that. Let's see. Yeah. Make sure we're still going. Alright. Now we're going, let's see, palpate. Alright, we did the popliteal. Alright, let's do the hip flexion. So lift this leg to 90 degrees for me, pretty straight. Alright, hold it. Good. Now we'll go knee to chest. Hold that. Good. Now we'll come out, assess the hip flexion. Good. And we'll rotate this for this hip. Good. Alright, this side, go 90 degrees with this side, up in the air. Hold that. Perfect. Alright, down. Knee to chest. Hold that. Perfect. Alright, we'll go outside. And then Let's see. All right. Pull against me on this. Push up. All right. Push the gas pedal. Good. Good strength there. +5 there. All right. And then, let's see.
I've never been checked out this thorough.
All right. Hips 90. We did the plantar flex. Okay. Maintain dorsal flex. Good. All right. Now we're going to do the Babinski. Where's my hammer? And plantar reflex. So Babinski. All right. Toes should curl in. So we'll do that. Yep. Good on that side. Good on that side. All right. Plantar reflex should. Yep. Now let's do the patellar on the knee. So scoot up on the side of the bed. All right, just let your knee dangle for me. Relax. Yep, we can see that. Okay. Ready? Knee should kick out right here. Good. On this side. Good. All right. Now I'm going to do the Achilles. Let's see. Achilles reflex. So I'm going to do your foot like this. You can see that. Good. All right. Now your foot should come down. Okay. Yep. Felt it. Good. All right. Let's see. Lower extremities. Achilles bilateral. All right. Lay back down for me. We're going to check the cerebellum. Yeah, either way. All right. Wait, let me fix the camera. Cerebellum function in the brain. So let's put your heel to this shin and go up and down. Perfect. Intact. All right. Do this leg, heel to shin. Perfect. Intact. All right, I think that was the last one. So lower extremities. All right, let's have you stand up for me. This is going to be stand-up assessment. Let's move to over here where we can see better. All right, standing up. So first we're going to test the Romberg test. So just stand straight for me. I'm going to assess for any swaying or anything. All right, eyes closed. Assess for any swaying. No. All right, let me do camera down. All right, stand on your toes for me. Okay. Now walk on.
Still have my eyes closed or open?
Open. Walk on your toes. Go back and walk. Walk on your toes to that wall over there. All right. Then walk on your heels. Come back to me. Walk on your heels. Okay. Now I'm going to get you to hop on one foot. Let me move this. Hop on one foot for me. Okay. I'll do the other. Perfect. All right. Now let's bend over, touch your toes. Good. All right. Bend back like this. All right. Now rotate this way on your hips. So we'll rotate over like that. Okay. Other way. Perfect. Now rotate your spine like this. Good deal. All right. Now I'm going to just inspect your spine area. Turn around for me. Turn around for me. We're just going to look straight ahead. Any pain or tenderness in this area?
Mm-hmm.
All right. Should have done that first. Should have inspected first, but we'll ride with it. All right. I think that's it. Actually, one more thing. Let's shrug your shoulders with a little resistance. So yeah, shrug your shoulders right there. All right, now with a little resistance. Perfect. All right. I think that's it. That concludes the head to toe. Now I'm going to do a little education. So I had a printout. I forgot it in my backpack. But you can see. We'll talk through some education regarding his hypertension management. He's currently taking the Benicar for hypertension. So first off, we'll talk about exercise. So he is already participating in 2 to 3 times a week in some moderate exercise. I put on my handout that getting his heart rate to 70 to 80% max heart rate is shown in research proven to reduce the cardiovascular events. So I'm going to educate him to go out, get necessary equipment to check his heart rate, whether that be a watch or something. Try to get up to 70-80% of that maximum heart rate. So I think maximum heart rate is 120 or 220 minus his age. So 220 minus 53 is 167, if I can remember correctly. So he needs to look to get his max heart rate around 167 in his exercise. Another thing, let's talk about diet. So with his hypertension and cardiovascular risk, we want to stay away from a lot of fats, trans fats, and cholesterol. We want to stay with lean protein, green leafy vegetables, that kind of diet. No fats due to the buildup of plaque in his arteries. Let's move to equipment. So I'm going to educate him to get a blood pressure cuff and a manual that he can keep his readings in, blood pressure cuff, and then there was another thing I put on the handout. Anyway, we'll educate him to get that, and then talked about diet, exercise, and then the importance of staying up on medications, so taking medications every day. Signs and symptoms of high blood pressure would be headache, nausea, and vomiting. So anytime that he has a headache, I would advise him to check his blood pressure and see where he's at and document that for a future visit. And I think that includes education. So that's the education part, head to toe. Thank you, and how we feeling?
Feel great. Thanks.
All right. Thank y'all.